Hi, here is my video for Vet 122 for abdominal radiographs. My name's Julianne, and I am currently entering in the patient's information into the computer. So today we're using Tucker. He's a French bulldog, about 25 pounds, and almost a year old, and he's going to be our guinea pig today. One of our LVTs is allowing me to use him. I am entering his information into the computer. Since he is 25 pounds, we will be using 80 kVp and 3.5 MAS using our technique chart. The chart that we have does go by weight. If you notice, before we are taking our x-rays, we are wearing proper PPE, using our lead aprons, thyroid shields, dosimeters, and lead gloves. Now, Tucker is not sick, but medical conditions that may lead to abdominal radiographs are abdominal pain, distension, vomiting, lethargy, abnormal urination or defecation, diarrhea, and appetite loss. So right now I'm getting my gloves out, but for positioning wise, there are landmarks that I want to look out for. On the caudal end of Tucker's body, I am looking for a location of the greater trochanter of his hip, and then also the cranial part would be the midsection of his ribs, which will be areas that I would want to make sure that I have a good abdominal view. The best position for a vomiting patient is left lateral view, just because of where the pylorus is located. In case the patient has a foreign body, you would have a good view of that in left lateral. The best position for visualizing the size of the liver would be in right lateral. It does appear much larger on that side for radiographs. Right here you can notice my lead gown is slipping off. And of course I had to take a break and readjust and fix the Velcro and slap that back on there. It's just so important to have proper PPE and make sure that everything stays on while you're doing x-rays. It is also better to obtain an abdominal radiograph on expiration, there is a maximum amount of space for the abdominal contents as the lungs contract and the diaphragm relaxes. As you can see here, we are preparing Tucker for VD or ventrodorsal positioning. And same thing here, I'm still looking for those landmarks when it comes to collimation. I want to make sure that I am towards the end of his sternum or in the middle of his ribs. Because he's a Frenchie, he has that weird anatomy. But more towards the middle of his ribs and then ending towards the pelvic region. So I want to be right in between there. All right, and that finishes our video of lateral and VD views of the abdomen. Tucker was a very good boy. And here are just a couple of pictures of the views that we took, the lateral and the VD abdomen. Thank you very much.